New acute patient. Sarah Smith is a 38-year-old female, Caucasian, with a medical history of a motor vehicular accident 2 years ago, resulting in a right broken clavicle, now healed. She also underwent recent dental surgery with 4 wisdom teeth extractions 2 weeks ago. Psychosocial history includes the patient is married with a 13-year-old daughter and 3-year-old son. She earned an associate degree in healthcare administration and is employed full-time as an administrative assistant at a local healthcare facility. She uses alcohol intermittently on a social basis. Today is complaining of runny nose, eyes, nausea and vomiting, and diarrhea. Good morning. It's nice to meet you. I'm Clarissa. I'm the family nurse practitioner. I understand that you're here to establish care with a provider. So, let's start with how are you feeling today?
Oh, I feel like I caught a bug or something. My eyes keep running, my nose won't stop draining. I'm sweating a lot and I feel nauseous. That started today. I actually vomited earlier this morning, which is really unusual for me. My kids bring home all sorts of germs, and I'm around sick people all day for my job, but I cannot miss any more work. I was just out for 2 weeks for dental surgery.
Okay, let's back up a bit. So the symptoms you're experiencing are new as of today. So that could be due to a number of things. So let's talk about some of them. Let's see. Do you have a history of allergies?
No.
Let me just confirm. No, it doesn't look like it.
And it doesn't feel like a cold or the flu either, since I don't have a sore throat and my ears don't hurt.
With your symptoms of nausea, I always ask about potential pregnancy, but I see here you had a tubal ligation 2 years ago, and in your history it says you are sexually active. Tell me more about your recent dental surgery. Were you prescribed a medication for that procedure?
Yeah, for pain. The oral surgeon prescribed 3 days worth of medication, but it did keep getting worse. And I have to be honest with you. I did start taking my leftover pain pills from my car accident 2 years ago, but I just couldn't stand the pain and I had to be able to function to take care of my family.
I'm glad you told me this, Sarah. Could you tell me the name, the dose, and how often you're taking this medication?
Sure. It's hydrocodone, 5 325s. And I did take it as prescribed every 6 hours, but then that prescription ran out, and that's when I found my old supply of pain pills from 2 years ago, oxycodone, 10 milligrams. But I ran out of everything yesterday.
I appreciate you being upfront and telling me about the medications that you're taking. So to confirm, no opioid medications for over the last 24 hours, is that correct?
Yes. And I do feel like I could vomit again. I've also been having some loose bowel movements. That started last evening.
Have you eaten anything recently that could have made you sick or have diarrhea? Something you ate that could have given you food poisoning?
No. I'm really careful about raw fruits and vegetables. I always wash them with a special soap that I bought. And we really don't go out to eat that often. I mean, we can't afford to. It's really only special occasions.
Okay. That's helpful to know. So tell me more about your pain. How would you describe your pain? How intense is it?
It is a sharp, constant pain on the left side of my jaw, towards the back of my mouth where one of my wisdom teeth was removed. And it has gotten progressively worse. I'd say it's even worse than before my surgery. And when I called the surgeon's office, they told me I should just take an ibuprofen and put a cold pack on my jaw, which did not help.
That must have been so frustrating to hear. Your pain might be an indication of a possible infection, so I think there are 2 things going on here that we need to address. Uncontrolled pain, possibly due to an oral post-surgical infection, and whatever's causing your other symptoms, the sweating, the upset GI tract. Given the timing of these symptoms, they could be related to possible side effects of you stopping the opioid medication.
I agree. I really don't want to have to take that medication. But I do have to function. I have to work. And I have to be able to take care of my family.
I understand. This must be such a difficult time for you. Would it be okay if I asked you some additional questions about the medications you're taking for your pain? It's a list of 10 questions, and it covers your drug use over the last 12 months, not including alcohol or tobacco. But then we can discuss strategies to control your pain and meet your goal of functioning at your best for your job and your family. How does that sound?
That sounds okay.
Great. Patient seen today for new acute visit. Notable physical examination findings include rhinorrhea in the nasal mucosa, skin that is warm to the touch with generalized diaphoresis. Patient reports 7 out of 10 pain in the left jaw area, generalized mild muscle aches and restlessness, sudden onset of nausea, vomiting, and diarrhea. Patient is sexually active with a history of tubal ligation in 2021. Substance use history. The drug abuse screening test, or DAS-10 by Skinner, was administered to the patient with a score of 2. Findings: low level of drug abuse with monitoring and reassessment at the next outpatient visit. The Prescription Drug Monitoring Program database aligns with opioid prescriptions reported by the patient. Differential diagnoses. Based on the assessment, consider differential diagnoses, bacterial viral infection, may be related to recent oral surgery, allergies, pregnancy, opioid withdrawal, opioid use disorder, chronic pain syndrome, co-occurring anxiety or mood disorder, point of care testing, HCG test to rule out pregnancy. Discharge instructions. Patient to be seen in 4 weeks for follow-up. Nurse to contact patient in 1 week to assess pain, nausea and vomiting, diarrhea, and analgesic measures. Patient instructed to contact oral surgeon with symptoms of possible infection and pain as soon as possible. Instructions given for over-the-counter pain medications, ibuprofen 800 milligrams with extra strength acetaminophen QID for pain as needed. Prescriptions for ibuprofen 800 milligrams QID for pain as needed, and ondansetron 8 milligrams every 12 hours as needed for nausea, electronically sent to patient's pharmacy. Patient instructed to drink plenty of water to avoid dehydration.